The posterior fontanelle, on the other hand, it closes quite early, within the second or third month after birth. The sphenoidal fontanelle, right here, it closes within the first 6 months, and the mastoidal fontanelle, it closes within 6 to 18th month of life. So there are infants born with without fontanelles, no, and with fused cranial bones and suture lines. That rare condition is known as craniosynostosis. Again, in craniosynostosis, we have completely fused infant skull at birth. So that condition is dangerous, and it can limit brain growth and development, and the constricted cranium will have increased intracranial pressure, and it can disturb brain function. It can cause seizures in the newborn and in the infant. So breaks in the suture lines are surgically created to relieve some of the signs and symptoms of craniosynostosis. So let me use another skull specimen here. This is, as you can see, there is a vertical suture line dividing the frontal bone, which is not usually present. This one is called the metopic suture. So during skull development, in utero, during fetal development of the skull, the cranial bones develop from fibromembranous structures, and there are bony islands. So for the frontal bone, it develops from 2 bony islands, and the bony islands will expand and grow, will meet up at the center, and normally there will be complete fusion of the metopic suture. So after complete fusion, it should be absent, like in most skulls. But here, this is incomplete fusion of the bony islands that develop into the frontal bone. So we have a metopic suture that remains here. So for the facial bones, we have the maxilla again, alveolar process of the maxilla, nasal bones. So the bones of the cranium and the face form the bony orbit, the space for the globe or the eyeball. So we have here the infraorbital foramen. So we have vessels and nerves coming out of the foramen. So let me bring back the other specimen from inside the orbit. From inside the bony orbit, we can see part of the sphenoid bone. That's the lesser wing up there, greater wing. We have this opening, this linear opening between the greater and lesser wing. That's the superior orbital fissure. So let me open up the cranium. You can see it right there, superior orbital fissure. So nerves and vessels going to the globe or to the eyeball will pass through the superior orbital fissure. You can see the nasal cavity here. So let me show you the open cranium. So we're looking at the base of the skull. Now we can divide this into three areas. The anterior cranial fossa, which is partly formed by the ethmoid frontal bone, and lesser wing of the sphenoid. So everything in front of the lesser wing of the sphenoid belongs to the anterior cranial fossa. So behind the lesser wing, we have the middle cranial fossa. It's behind the lesser wing of the sphenoid, in front of petrous part of the temporal bone. This thick bony ridge right here, that's the petrous part or petrous portion of the temporal bone. And behind that, we have the posterior cranial fossa. It's important that we can identify openings in the anterior, middle, and posterior fossae, and the structures that pass through those openings. So this part is called the cribriform plate. This thin and sharp spike right here, that is called the crista galli. There are openings lateral to the crista galli at the cribriform plate. That is where nerve fibers of olfactory nerve will pass through. We also have two round openings here, right and left. They are the optic canal or optic foramen. So what structures are transmitted through the optic foramen or canal? We have the optic nerve and the ophthalmic artery. Ophthalmic artery comes from the internal carotid artery. So it is a branch of the internal carotid which will exit or leave the cranial vault, and it will supply structures right here inside the bony orbit.